All right, let's jump right into this. We're going to be exploring a really unique and, honestly, pretty provocative system of healing called Yuanshidian. You can think of it as origin point therapy. We're going to walk through its foundational handbook to really get a grip on its core ideas, its methods, and its completely different way of looking at what actually causes disease.
Right off the bat, this is the mission statement from the therapy's founder, and it is a bold one. This isn't just about feeling a little better, it's about fundamentally changing how we see health itself. I mean, that right there sets the stage for a total rethinking of medicine as we know it. So the whole system really kicks off with this one single, really powerful idea that the pain you feel, the inflammation, the diagnosis you get, all the things we normally focus on treating, they're not the actual problem. Think about it like this. If you see a shadow on the wall, what do? Do you try to paint over the shadow or get rid of it? No way. You look for the object that's casting it, right? Well, that's the core metaphor of Yuanshidian. The therapy argues that modern medicine often gets totally stuck trying to fix the shadow. Okay, so what is this shadow they're talking about? The handbook calls it guo, which basically means the effect or the fruit. And this covers everything, from a simple headache to a tumor they find on a scan, and even things like viruses or bacteria. According to this theory, all of that stuff is just the end result, not the starting point. All right, so if all that stuff is just the shadow, then what's the actual thing casting it? The source calls this the yin, or the cause, and it argues there are really only two main culprits: some kind of physical injury or tension in very specific spots on the body, and this underlying condition it calls a cold constitution. And this is where it really gets to the heart of the whole philosophy. On one side, you've got the shadow, the symptom, the diagnosis, the thing that gets all the attention. But on the other side, you have the cause, the real origin point, which shows what's actually going on in the body. The therapy's take on this is, well, it's pretty radical. It says to completely ignore the shadow and only ever treat the cause. So, okay, that's the theory. But how do you actually find and treat this cause? Well, that brings us to the hands-on part of the therapy, finding and pressing what they call origin points. Let's take something super common. You've got a headache, maybe you're feeling dizzy, or you can't sleep. All problems that you feel in your head. So where would you treat it? So here's the twist. According to this system, you don't treat where it hurts. The handbook tells you to go to these specific origin points, behind your ear and right along the base of your skull. See the logic here? The headache is just the shadow you're seeing in the front of your head. The real cause is the tension that's hiding in the back. Okay, let's try another one. What about stuff happening in your torso? You know, things like chest pain, asthma, or even deeper issues with organs like your stomach or lungs. And you guessed it, the treatment isn't where the problem seems to be. For all these issues you feel on the front of your body, the origin points are actually found on your back, all along your spine. It's kind of like these points are switches on a circuit board, and they control everything that's happening out in front. And this same logic, it applies all the way down to the lower body. Think about really common problems like sciatica, nagging knee pain, or pelvic issues like menstrual cramps. The source traces all of these lower body problems back to origin points higher up, on your glutes and your sacrum. So get this, for pain in your knee, you wouldn't touch the knee at all. Nope, you'd find the tender spot on your hip that corresponds to it and work on that to fix the root cause. But pressing these points, that's only half the battle. Remember that second cause we talked about, the cold constitution? That brings us to the other huge pillar of Yuanshidian therapy, the absolutely critical role of heat. The handbook makes this really sweeping claim. It says that pretty much every significant disease comes from a body that has become fundamentally cold. It even says that the whole idea of a hot constitution, which you see in other traditional medicines, is just false heat, another kind of shadow. So how would you even know if you have this so-called cold constitution? Well, the source gives a checklist of signs. If you're tired all the time, you really don't like cold weather, you've got a pale complexion, the handbook would say your body's internal furnace is running low. So here's the key takeaway. The complete treatment is a simple two-part punch. First, you press the origin points to deal with the physical tension, and second, you apply heat, both inside with warm foods and outside with things like heat packs, to get your body's core constitution back in balance. Okay, so now
If you take this entire framework, the idea that symptoms are just shadows and the real causes are tension and a cold constitution, and you apply it to everything, you end up with some very unconventional ideas about major diseases. Let's see how that logic plays out.
For example, what does this theory have to say about some of the biggest challenges in modern medicine? Cancer, viruses, vaccines? The handbook doesn't shy away. It applies its shadow versus cause logic directly to all of them.
Check out the sources view on cancer. It compares a tumor to a block of ice. The ice didn't just appear out of nowhere, right? It only formed because the temperature dropped. The handbook is basically saying that surgery is like chipping away at the ice, but never turning up the heat. It claims the ice will just form again unless you warm up the whole environment. And it doesn't stop there. The handbook goes right after germ theory. It argues that viruses and bacteria don't cause the sickness, they're a result of it. Just another shadow. They're seen as a little opportunists that can only thrive once the body's cold constitution has created the perfect breeding grounds for them. And, well, that leads us to its take on vaccines. The source argues that infectious diseases have their own natural cycle, and they disappear on their own over time. It gives credit to that cycle, not vaccines, for their decline. It's basically saying that focusing on a specific virus is, again, just treating the shadow instead of the real cause, which is the body's own internal environment. And that really brings us to the final, huge question this whole system leaves us with. Look, whether you agree with its conclusions or not, the Yuanshidian handbook forces you to ask a really fascinating question. If everything we typically focus on, the pain, the scan, the diagnosis, if it's all just a shadow, then where have we been looking for answers all this time? And more importantly, where should we be looking instead?